Alright, so today we will be talking about ICD-10 coding. ICD-10 codes are abbreviated for International Statistical Classification of Diseases and Related Health Problems 10th Revision. These are commonly shortened to International Classification of Disease when used by health professionals, insurance companies, and public health agencies worldwide to represent and track diagnoses. All HIPAA-covered entities must adhere to these codes unless the patient is on workers' compensation. But the trends are heading towards using ICD codes with these patients as well. This system is used to monitor incidence and prevalence of diseases, observing reimbursements and resource allocation trends, and keeping track of safety and quality guidelines. Other factors tracked are deaths, diseases, injuries, symptoms, reasons for encounter, factors that influence health status, and external causes of disease. There are two coding structures. Procedure coding systems, abbreviated as PCS, is used in the inpatient and hospital settings and consists of 87,000 codes. Clinical Manifestations, abbreviated as CM, is used in clinical diagnosing and outpatient settings and consists of 68,000 codes. These code structures for the billing system is as follows. The first character must be an alpha character, excluding the letter U. The second and third characters are numeric, and characters 4 through 7 can be a combination of both. The first three characters characterize the injury, and then the 4th through the 7th describe in greater detail the cause, anatomical location, and severity of illness or injury. Now let's talk about the history of ICD codes. The first International Classification Edition, known as the International List of Causes and Death, was adapted by the International Statistical Institute in 1893. The World Health Organization, or WHO, was entrusted with the ICD at its creation in 1948 and published the sixth version, ICD-6, that incorporated morbidity and mortality for the first time. With this sixth revision, its name was changed to the International Statistical Classifications of Diseases, Injuries, and Causes of Death. Originally, they prepared to have a revision every 10 years. After publishing the 7th and 8th edition, it was found that 10 years was too short of an interval. The ICD is currently the most widely used statistical classification system for diseases in the world. As of October 1st, 2015, ICD-10 was activated. Next, we will look at the national effect this coding system has on physical therapists. ICD-10 code sets enhance the quality of data for tracking public health conditions such as complications and anatomical locations, measuring outcome and care provided to the patients, and making clinical decisions. Compared to ICD-9, ICD-10 code sets have nearly 19 times as many procedure codes and 5 times as many diagnosis codes. ICD-10 has alphanumeric categories, leading to some titles being renamed and conditions grouped differently. In this photo here on the PowerPoint, it has listed the key differences between ICD-9 and ICD-10 code sets. ICD-10 now allows for easier comparison of mortality and morbidity internationally. There has also been improvement in data measuring and tracking. For example, therapists can now track the Glasgow Coma Scale and complexity of disease conditions with precise identifications for each patient. Now we are going to look at the daily impact on individual physical therapist practice as it obtains to financial planning, management decision-making, and policy and procedure development. Financial issues have affected the patients more so than the actual physical therapists. With the increasing number of codes, the physical therapist must ensure they are applying the correct codes to each patient. The therapist must capture each chronic condition the patient has had in the past, which is now affecting their current health condition, and could possibly be limiting the patient to reaching their discharge goals. If the coding is not correct, accounting errors will increase, which will then create the possibility of overwhelming the billing department, leading to increased reimbursement time for the patients. So the bottom line here is, as physical therapists, we have to ensure that they are that we are correctly coding for each patient to be properly reimbursed in a shorter period of time. The largest change for management was preparing the staff for the large number of codes added with this version. As mentioned earlier and shown in the table below here on the PowerPoint, there is little direct mapping overload between ICD-9 and ICD-10 codes. For the healthcare management, this means education is key. Management provided to prepare themselves and for their staff for the change with this coding system needs to happen first. So there has to be time for implementation and testing of the new codes into the daily workflow, making sure that the staff is trained properly. With the implementation of ICD-10 policy and procedures needed to be adjusted. If a policy or procedure has ICD-9 wording or language or the actual codes contained within it, these certainly need to be reviewed and updated. Shown here in the PowerPoint, on the first box are specific coding policies and procedures that may be included in this section. There will also be very specific ICD-9 coding policies in this place that will also need to be changed. Again, examples are listed here in the second box of the PowerPoint. Thank you for watching and listening to my presentation today. If you have any questions, please let me know, and I hope you have a wonderful day.